using what I would call an education model, which was adapted from what I learned at PNHP. And that consisted of a lot of fact and policy oriented speeches, grand rounds, joining in with debates held in public forums, um, serving as a panelist on various panel discussions. I founded a nonprofit organization that was oriented towards mostly education about all kinds of health advocacy around issues like Medicaid, expanding it in Utah, a conservative state that has traditionally had very restricted access to Medicaid, but the non-policy also was supposed to, as it was originally founded and intended, spend half of its time on single payer advocacy. Um, that's that organization is called the Utah Health Policy Project, and it still exists and still works very hard, especially on trying to connect people to Obamacare plans. Um, Other things in the educational model included publishing op-eds. I can't even begin to count how many opinion pieces I've published in papers, small and large, all across the state of Utah over the last 25 years. I've published 2 books. I've produced a film. We've spent a lot of time trying to seek collaborating organizations and individuals um, in Utah. These are all good and very important things to do. And there's a lot of you who've spent a lot of time doing exactly that where you are. And I would say probably more successfully, especially on the collaboration front. In Utah, people who are naturally interested in single payer and are intellectually in agreement with the proposal are hesitant because that might put them cross purposes with very important political interests in the state. And so I probably haven't succeeded as much as, for instance, I know in Oregon there's a large, and in Washington also, there are large numbers of collaborating organizations that have joined in with Healthcare for All Oregon, for instance, or the Washington equivalent. I ran for office 3 times. I'm naturally, from my upbringing in Arizona during the Goldwater era, I'm naturally a Republican, and I ran as a Republican once for Congress more recently, but in the 2006, 2008 range, I ran twice for the legislature, never successfully because I happen to live in a part of the state that is one of the few parts that consistently votes Democrat, so I did not get elected. But I found all of that to be remarkably ineffective in moving the needle, in making progress towards an actual moment of change where something actually would be different. I haven't given you all the details that include being at the legislature year after year after year, advocating for small incremental steps or sometimes larger things. But we didn't even get a study. And I've seen that happen in other states where at least somebody's been able to fund, or in the case of Oregon, I note that they're working with the legislature in a stepwise fashion to try to organize single payer. That's just simply not possible here in Utah. Just won't happen. So, long story short, after the pandemic, I was approached because of my profile as perhaps the only person with single payer advocacy credentials. I was approached by a dozen or so people who had noticed how singularly poorly the health system in Utah had functioned during the pandemic. There's a lot of sense in Utah. It's a conservative state. People feel like we do things best. We do things differently. They call it the Utah way, and they somewhat in a self backslapping kind of way believe that everything's better here, like the health system. And so there was a great deal of surprise in some quarters about how poorly it functioned and how it failed us during the pandemic. And so several people approached me and said, we need to do something. Our health system isn't as good as we thought it was. What do you suggest we do? What can be done? And I got about a dozen or 15 of those people to agree to sit down and just have a series of private conversations. Most of those people were physicians. None of them were single payer advocates. Some of them had heard of PNHP, Many of them had heard of the concept, mostly from Bernie Sanders campaigns. They heard the concept about single payer, knew roughly what it was, but they were decidedly not single payer advocates. And we discussed, I basically did a chalk talk over 2 or 3 sessions that mirrored more or less a PNHP Grand Rounds presentation. Although I didn't use the slides, I just simply talked with people. We would throw ideas up on the blackboard, et cetera. Eventually, we decided on a strategy. I had told them that I would help them kind of think through what they thought the best options were, and they could make whatever selection as a group they wanted to. But that I would only participate in the ongoing effort, whatever they chose that to be, if it were a state-based single payer by ballot initiative, because I didn't think anything else would be a good use of my time. So they knew that going into the discussion, and eventually that is what they agreed to do. Now, whether I forced their hand on that, I don't know, but we chose, instead of an educational strategy, we explicitly chose a political strategy. What I mean by that is we did not try to found an organization that was a 501c3 where you can make tax deductible contributions. And instead, we chose to found a 501c4, explicitly a politically advocating organization with the explicit intent of the organization to seek a way to bring single payer to the ballot by ballot initiative as soon as possible. So we knew what we had to do was different than the Grand Rounds strategy. We did, I trained a few of them to write some op-ed pieces, and I did so also myself over a few months. We were actually actively working on this project together for about 2 years, ending very recently. So the principal objective of this group was to find and organize and write out or define somehow our candidate. This is a political campaign. You know, in a usual campaign, somebody's running for office, the candidate identifies themselves. Sometimes they're recruited, but there's a particular office in mind, and your job is to try to put that person on the ballot and then get them elected. In this case, we don't have a person, we have an idea, and that has to be translated into statutory language so that it can be put on the ballot as a ballot initiative. So our candidate, if you will, is a health policy, single payer health policy that fits into what already exists in Utah, and so has some unique Utah kinds of twists to it. We spent a lot of our time together in the last 2 or 3 years working out what that policy is. And we reached out to a number of you in the national single payer community and had consultations from people in, for instance, in Pennsylvania and in Minnesota and in Washington who had already had experience writing ballot initiatives that were single payer. We reached out to people inside Utah who had experience in, say, the hospital industry or in other health policy arenas. We raised enough money. Our job initially was to raise enough money to buy the especially economic consulting services that we needed to characterize our candidate. How much will this cost? What's being spent in Utah on healthcare? What do we know about the future projections of cost? How would this function? We hired eventually Gerald Friedman at the University of Massachusetts, who helped us with characterization of the economics of our proposal, which eventually we began to call Utah Cares. That's what we named our future possible single payer in Utah. So we were working away at defining our candidate very incrementally. I mean, we had a policy committee. As I said, we took information from all over the country. We studied other attempts at writing single payer legislation at the state level. The second thing was we hired a campaign manager. At the time, we called her our executive director of the 501c4 nonprofit. and got her help to try to think through a strategy. What's the campaign strategy? Where are we headed with this? She did enough background looks at the future options. You can put ballot initiatives on the ballot every other year in the even numbered years in Utah. She began trying to figure out who has been successful at that. How did they do that? Who are the right consultants to get? And how do we find a way to write the statute? What's the best way to do that after we have a policy we'd like to suggest? Ultimately, she told us that we would be best if we would use the year 2026 as our campaign year. And she made that case because that's a year when there will be no statewide office, or of course, it's not a presidential election year. This Utah representation in the U.S. Senate. There's an election this year. There was one 2 years ago, so there will not be one in 2026. And our governors and the other statewide offices like Attorney General, they're elected on the same year as the presidential elections. She felt like that would give us a smaller electorate, and more likely the progressive element that would be attracted to our issue would have a greater say, if you will. So she helped us organize ourselves around what felt like at the time when we started plenty of time. That was 2022 or so when we were first getting organized, when she came up with our strategy. She also said we had to eventually form another organization, not a 501c4. You have to run a ballot initiative with a political issue committee in Utah, a PIC, if you will. So we knew we had to do that as well. By the spring of this year, our policy committee had pretty much submitted its draft policy to the rest of the board, and it had been adopted. That organization, by the way, is called Common Sense Healthcare for Utah. And I served as the chairman of the board, and I was on almost all the committees, and then continually tried to help everybody with their fundraising or the policy or whatever. So anyway, we came up, our policy committee came up with something the board could adopt. They even went so far as to write a very long, maybe I don't know, 25-page frequently asked questions about what the policy would include, and they submitted that and got it approved by the board as well. We had by that time finished our economic, at least gotten a preliminary draft from Gerald Friedman. We had hired another economic consultant with Utah ties who understood the Utah tax code, because of course you have to fund this, and it's got to be funded with state money as well as the large amount. You have to entrain the large amount of federal money that goes into healthcare. It's true of Utah, of course, as it is in every other state. Most of the money in the healthcare system is federal. And you have to figure out in your policy how you're going to get Medicaid, Medicare, and other federal funds brought into the system. At this point, there was a great deal of trepidation on the part of the Common Sense Healthcare Board. As I said, most of them are physicians. None of them had really any political experience. And they began to be somewhat fearful about whether we could actually get to the ballot in 2026. It's a very big leap to get onto the ballot. And enough of them became concerned about that there was some reluctance to move further with our strategic plan. So I just swallowed hard, started the PIC on my own, went back to the board and said, I'd like to challenge the board to simply fund with as much money as the board can see reasonably to give to it, the PIC, and we'll launch it. And the board itself, the Common Sense Healthcare Board, can continue to function as principally an educational institution with the goal of being the long-term source of education, fostering of the single payer movement in the state of Utah. And there was agreement about that. So I have, since August, been no longer associated with Common Sense Healthcare Utah. They live and exist on their own, and they're developing their own agenda about how to foster the single payer movement in Utah. And I've taken the campaign manager with me and one board member who previously ran other ballot initiatives in Utah with me into the PIC, which is called the Utah Cares Political Issue Committee. We have hired a public affairs organization. We've raised enough money, and I think the total amount of money that we've raised in this effort over 2 or 3 years is now somewhere between 150 and $200,000. We've raised enough that we've hired a public affairs organization that has successfully brought progressive ballot initiatives to the state, brought out of state national funding to make it for the several millions that you need to run a ballot initiative. And based on that success, one of the successes was in expanding Medicaid. In 2018, they were spearheading an effort, eventually funded by the Fairness Initiative, to expand the Medicaid program in Utah to take advantage of the Affordable Care Act expansion, which to that date the Utah legislature had just refused to do. So we have that organization. They're working with us now. If you would, Mike, would you put up the document that I sent to you so I can talk people through this? We have now written a with the help of our public affairs organization, we've written a prospectus, which is what you're seeing here. The prospectus is intended to be used to go to both in-state and out-of-state funders and explain to them what this process will look like, and try to encourage them to become interested in providing us with the substantial amount of funding that we need to move forward. Utah Cares, again, is not just the name of the PIC, it is the name that we are giving to our single payer, ultimately. And we state right up front, as you can see at the top of the page, that we are intending to bring this to the general election in 2026. There's a couple of facts about the poor functioning of healthcare in Utah as it is right now, and those could be supplemented with a number of others. And I won't bore you with those details, but some of these facts we had to pay economic and other consultants to help us understand it. For instance, the one down below, for 30 years, Utah has had the second fastest growth rate in healthcare costs in the nation, which, if continued, will double healthcare expenditures every decade. Utah thinks of itself as the least expensive healthcare cost state in the nation. That's what most of the lists of states by healthcare costs have said over the last, 20 years since I've been following that literature. And so most Utahns think, oh, well, we're doing really well in terms of cost. And we had to counter that by understanding other things about it other than just where we are currently. We hired the University of Utah Matheson Center for Healthcare Studies to look at healthcare costs in Utah, and they're the ones that came up with this data. So we have a report from them that talks about how fast healthcare costs are growing. Now, down below that, under our unique approach, you see basically summarized what we're proposing. And I think all of you will recognize the various single payer features that are there. Our key thing that's kind of different, I think, than what I've seen from other states is that we are using an already existing payer called the Public Employees Health Plan to be the basis for our single payer. We're going to convert it, rename it the Utah Cares Plan, and transition stepwise from them simply serving 200,000 to 300,000 Utahns who happen to have public employment, either at any level of government other than federal government, any other level of government in Utah, at the state level, universities, other public institutions, local governments like county governments or city governments, town governments. They can all use Public Employees Health Plan if they so choose for the health benefit for their public employees and the dependents of those employees. We have found PEHP to be a very, very efficient provider of health financing. Their overhead is less than 4%, so it mirrors the overhead of the major governmental payers for healthcare. As I've already said, we're going to convert it to a universal source of financing for all of Utah. We intend to make it very cost supportive of patients so that there won't be any out-of-pocket costs at the time of service. They're free to choose whatever care source they would like as a patient. We will save over the current healthcare business practice by the simplified administration provided by sole source of payment. We will negotiate with a monopsony power, we'll negotiate better prices. And we insist in this, as we write the statute, that there'll be negotiated global budgets for hospitals, and any institution that has patients overnight will be subject to that negotiation. We plan to negotiate fees for physicians and other healthcare providers. The payment rates will be improved, especially for the Medicaid population. So we put into our economic model a substantial increase in rates of payment for Medicaid and Medicare patients. We obviously the employers no longer have to purchase health benefits for their employees. Utah, most of the employers do self-funded plans, so they're governed by ERISA. We cannot, as you all know, with a state statute, we cannot enforce anything on those self-funded plans. But because of the next line, that is, we're creating a broad-based business tax to support this, based on the economics that Jerry Friedman put together. We think that most employers, knowing that they're already paying a tax and that their employees can go on to Utah Cares, we don't think that they'll continue to buy or arrange for a self-funded plan. Keep scrolling down. So that's our basic plan that we're trying to tell people about and prepare them for. We've also paid for some initial polling to suggest to our possible funders that Utah's ready for this politically. We tagged a couple of questions onto a poll that was already being done by Noble Predictive Insights, which in Utah is a well-known and well-regarded polling source, asking what Utahns think about the healthcare system. And the majority rated it a C or worse, and the majority also support improvements in some form, although we didn't specify what those might be, just major versus minor. And very few say that there doesn't need to be any change. So we're starting with that, and then go on down to the next one. Why in 2026? I've already sort of captured that for you. What you don't know is that there's been a lot of back and forth in Utah about ballot initiatives. Several ballot initiatives, including the Medicaid expansion, basically overruled the legislature, and the legislature, being what it is, very and a supermajority Republican, very, very conservative. They don't like being overruled, and they've pushed back gradually by trying to change ballot initiatives, especially the one that had to do with the gerrymandering that happens every decade in Utah. There was Better Boundaries, it was called, initiative that passed that would have required the legislature to follow what an independent commission came up with for boundary lines for various districts, political districts, for Congress, for the legislature, et cetera. And the legislature just flat refused to follow that. So they were sued by the Boundary Initiatives nonprofit. And the Utah Supreme Court recently ruled in favor of the ballot initiative nonprofit. So they're rolling back what the legislature has been trying to impose, and now is a good time, a good window for us on the cover of that recent Utah Supreme Court case. It's good for us to try to pass something that otherwise would be subject to a good deal of legislative review and maybe reversal. So I'll stop there and take questions.
See, Sam, your hand is up.
Thank you. Joe, thank you very much for this review. I'm bursting with questions for you, but quickly, I presume that your plan would leave Medicare alone, but eliminate Medicaid. Is that correct?
Medicaid in Utah, I'll take Medicaid first. Medicaid in Utah is exclusively done through managed care, for-profit managed care organizations. And our statute, which is currently being written, I failed to mention this, we found a state senator who was willing to take out a bill file knowing that we would use it as the basis for a ballot initiative, and simply make it his priority this coming session, and therefore use the state legislature's council bureau to write the bill for us. So we don't have to pay for an attorney outside the legislature to do that for us. It's been a huge savings. Plus, we get the inside help of the consulting tax people from the Legislative Council Bureau and making sure we write the tax part of this correctly. So the Medicaid part of the bill is a fold in. We will simply tell Utah Cares, the new name for Public Employees Health Plan, that one of the early steps they must do is become a managed care organization for Medicaid. And our bill basically says, as of a certain date, that transition must occur. That is, the current for-profits who are both out of state have to be kicked out of Medicaid, and it's all rolled over to Utah Cares, and will be the managed care organization from then on. That's how we're going to handle Medicaid.
Thank you. And Medicare?
For Medicare, what we've decided to do, again, of course, we can't force Medicare enrollees like myself. I'm on traditional Medicare with a supplemental. I can't be forced to be part of Utah Cares. Because there's no state statute that can do that. But we intend to create a Part C plan, an advantage plan, if you will, that is Utah Cares. And it's going to be much better than what I have on my supplemental. And we'll just simply open enrollment. And again, in the statute, the Utah Cares people are required to go through the steps to qualify to become a Medicare Advantage plan. They are the negotiating point for Utah after the statute passes between Utah and the federal government, and they just need to work out whatever details, assuming the federal government will go along with that, which we, of course, can't control, but we hope for.
Okay. And Sam, if you have further questions, we'll take you on the back end of the others, just to honor our guests here. Barbara, then Catherine, then Hank, then Lee. Barbara?
Yeah, so my first question is, what is it called? PEHP? How did you get them to say, yeah, you can take us over?
Well, we have spoken with them. I actually have been interested in them for many years. I don't know if you all remember that there's a Utah, John Huntsman Jr., who was our governor and eventually served as ambassador to both Russia and China. China under Obama, Russia under Trump. But he's run for president, so maybe that you might remember him. But when he first was elected governor, he contacted me and said, what small step can we take to improve healthcare in Utah? And I said, allow Public Employees Health Plan to sell health insurance to anybody in Utah, not just to public employees. And he organized, he got a sponsor for that bill, and it would totally got squashed by the opposition. But I forgot where I was going with this. How do we get PEHP? So that back then I interacted a lot with PEHP, talked with them. I began to get acquainted with their leadership. During our process at Common Sense Healthcare for Utah, we renewed that friendship. We contacted the current leadership, sat down with them, talked with them. We can't expect them to be our advocates. We can't expect them because they exist under statute in Utah. One of the nice things about using PEHP is there's a whole lot about this that we don't have to create in the ballot initiative, making it a much shorter statute, that people can review much more easily. And I don't expect them to be saying, oh, yeah, this is a great idea, but they gave us a few hints about what it has to look like. And I intend to take the statute once it's finished, and it's not quite done yet, take it to them and ask them to review it and give me some more suggestions. They haven't ever said, you can, yeah, sure, come on and take us over, but they can't do that. They're limited in what they can do as a private nonprofit trust fund that operates under statute in Utah in a very quasi-independent way, away from the rest of the administration and the legislature.
So I was expecting just that they hadn't actually said it, but that you had worked closely with them. my biggest question though is, and you don't have to answer it to me, but at some point, have you spoken with anybody about the state-based Universal Health Care Act and how it would apply or help Utah?
Oh,
You don't have
yes.
to answer me, but
Yeah, absolutely. I have. I've talked about it a lot. We're not assuming that it's going to pass because, of course, that's a big if. We're writing the statute,
as
um,
it,
trying to make it so it'll work whether it passes or not. But I have lobbied Utah's congressional delegation up and down for many years about this concept, back when it was being sponsored um, by who was it from the state of Washington before from
Jayapal?
Jayapal, before Jayapal. I mean, I've been working that forever and just haven't made any headway. The Republicans who are quote unquote the most moderate and currently in Congress from Utah, I've sat down with both of them and they both said, "Oh, it's sponsored by a Democrat. No way I'm ever going to work with a Democrat." That's so yeah, I have talked about it, and I do hope it passes because it will make this easier.
Okay, thank you, Barbara. And Jim McDermott is who we're thinking of,
Yes, that's right.
HR 1200, I believe. Catherine Lewandowski, then Hank, then Lee. Catherine?
Hi, Dr. Joseph. Thanks a lot for all the work you've been doing in Utah. It's just incredible. I wasn't sure if people here, I just found out about another group called Respect Voters, and they're working to try to kind of combat all of the legislation that's trying to be passed to make it more difficult for states that have ballot initiatives, make it more difficult for people to put them on the ballot. And then what I heard about is that they are also interested in trying to help states that don't have the ballot initiative process to be able to get it. So it's kind of an interesting group. And I heard that from Katie Fahey, who we've been working with from an organization called The People. And she's the one who won the ballot initiative to change to fight gerrymandering. Anyway, it's an interesting group, and I just started checking them out, and I thought everybody would maybe like to know about it. And I don't know if you've been in touch with them at all.
No, Respect Voters. I've got it on, written it
Yeah.
down.
I think when I Googled, I think it's respectvoters.org.
Okay, thank
And
you.
if somebody finds the link, just drop it in the chat, please.
Oh, sure, I can do that.
Thanks, Catherine. Let's see, next up is Hank.
Hi, thanks. Again, thanks Joe, for your work. Two asks and a question. Your funding scheme, do you think is that, can you share that in any type of way? We're always looking for, quote, a creative answer to the question of how is a state going to, quote, fund it? And we have done two models in the last 5 years, a little different nuances. Who in other words going to quote is going to pay the tax? So I don't know if you can share your funding scheme
with this group, knowing that you're all very, very circumspect in how you talk about these things. It's not public yet. We haven't actually put it out there, but
then that's fine.
We are planning to use a gross receipts tax.
Okay, that's fine. The comment of you're using the public employees is creative. All of our models here that we've worked on in Maine and legislation, it is sort of models using the Medicaid mechanism, shall we say, as opposed to the public employees mechanism. In other words, through the Department of Health and Human Services, but sort of carve out the payer mechanism, the receiver of funds and the disperser of funds. I think the public employees in Maine use a Cigna, shall we say, as its entity. So again, could you get? I'm not sure whether your folks, you do their own 4% administrative or whether they farm it out to a private firm, shall we say, to do the billing and the payments.
No, they do. This is what is so useful about PEHP. They are a distinct organization that a number of public entities, cities, towns, et cetera, and state employees use as the payer. They do it all. They long ago chose, they chose the corral instead of the reins method, if you will, to manage physician payment. So what I mean by that is rather than try to get doctors to get authority to do a test in advance. They allow doctors to basically do whatever they think is right, and then they look for the outliers who are abusing the system, which is a relatively minor number, you know, less than 3%, and they try to put reins on them. The rest of them sit in a corral and they do whatever they want. So the authorization problems that are so common in for-profit insurance companies, that just doesn't exist in PHP, and their administrative costs are therefore for that and a number of other reasons are much lower.
Okay.
They operate in a much more efficient way, much like Medicare, traditional Medicare.
Sure.
So
Sure.
there are private payers that are trying to steal portions of the public employees, and under Utah law, they're allowed to do that. And mostly how that happens is they get large organizations, say like the University of Utah, which has a large number of very healthy employees and dependents. A private entity will use some broker and get to the committee on campus that makes the decision about where they're going to buy their health benefit from, and with under the table payments will steal the business away from PHP. That's part of the history that goes on. PHP is always under attack that way. Interesting.
Yeah, and the third question is
Well, Hank, I'm going to just ask you to hop in the back of the queue,
Okay.
the way I did for Sam, just to be
bet.
honor. Thank you so much. Lee, and then Sam, and then if you hop in, Hank, you can come up third. Thank you. Lee?
Yeah, Joseph, thanks for coming out and speaking to Healthcare for All Oregon a couple of years ago at one of our annual meetings, and you're doing great work. My question is, in terms of your organizing for a ballot measure, ACO has been working for years finding on unions, businesses, mostly small business, unfortunately, churches, et cetera, that give us a base of support to fight to win a ballot measure. Are you doing organizing among building constituent forces to both fund and help get the vote out?
Well, yes, but it's a unique environment. For instance, take labor unions. It's a conservative state, and it's an open shop state. There are very few workers actually unionized in Utah. So it's not a very powerful force. I've spoken to union membership over the years on several occasions and would be happy to do so. Always send out signals that I'm interested and willing to connect, but they've got other fish to fry, and I generally haven't had invitations from them. So yes, of course, we've reached out. You mentioned churches. There is one big church in Utah. There's plenty of other churches, right? But there's one very big one. It's actually the largest employer in the state. And of course, it's nonprofit. I have worked to get their understanding, and just for clarity's sake, I'm an active member of that church. So I've worked to get connected to various leaders of that church and get understanding from them about what it is that I'm doing and what I'm proposing. And at the point when I actually have the statute written in draft form, I plan to go meet with some of the presiding leaders of that church. Because in the past, when I've done that, and for instance, when I founded the nonprofit Utah Health Policy Project, I went to them and explained what we were trying to do, and they turned around and made a $40,000 contribution to us. So it's not like they're they're very connected with the idea that people who are sick and injured need care. When I served as a bishop in a local congregation for that church, I wrote checks, welfare checks, for a limited number of problems. This is allowed under church rules, one of which is health problems. I could write checks from the church to support people who had illness and injury costs that they couldn't bear. So the church is very interested in this. They just will never come out and say, they won't join a coalition, and they won't come out publicly and say, this is what we're supporting. They have done so on certain political moments, but very few. And this isn't going to be one of them. So it's tricky. And because of their dominance, the next largest congregation in Utah, which would be the Catholic Church, would probably, although I've spent a lot of time with the Catholic Diocese in Salt Lake City, they're very sympathetic. They probably also would sort of kind of say, we hope you do well, sort of thing. So one of the things I'm hoping to accomplish, to say with the LDS Church, is to say, you've got this very large self-funded health plan called Deseret Mutual Benefit. Would you agree, and would you state publicly that if this passes, you will right away melt your benefit package, your self-funded plan, into Utah Cares? I think that's an answer they could give, and I think they might actually say, yeah, we won't be opposed to that. We'll be with it. That would be enough of a signal, I think, to let everybody know it's okay. So yeah, we're working on that, but we've got a completely, totally different landscape to work on than is true for all the rest of you.
Thank you, Lee. And I'd love to have a conversation with you, Joe, more deep dive, having done a lot of this constituency coalition building work, and would just love to get a better lay of the land in Utah. I'm thinking also League of Women Voters, educators, social workers, potentially, you know, folks who are more in the trenches and more sympathetic. So I'd love to have that conversation with you if I can be of any help.
Okay, great.
Thank you. And the church that you left unnamed, that's Latter-day Saints, right?
No, I actually did name the LDS Church. Yes.
LDS, you did say that. I didn't catch that. Okay, right. Obvious for most people, just wanted to be clear. Let's see, Sam, you're back up, and then Hank, and then Barbara. So we're going round robin here. Keep going, Sam.
Thank you, Joe. This actually builds on something Chuck just mentioned. Here in Oregon, we have very few Republican legislators or elected officials of any kind who will say something nice about universal care. And the few that have either lost their elections, left the Republican Party, or both. Is there a way we should package the concept of universal care in a way that does not repel Republicans?
I can't claim to have had any success with elected officials who have an R behind their name. I tried to be one of those elected officials with an R behind my name, and therefore I would have been an exception, but I never got there. My target isn't them very much anymore. My target is the vast majority of people who align themselves on the Republican aisle, and that's most Utahns and mostly LDS members, and instead talk to them about the principles that I think will draw them into universal care. And those are, it's constitutional, it's fiscally responsible, and it's a fulfillment of the moral mandate of, and you fill in the blank here, of any religion, even atheism. It fulfills the moral mandate of, certainly of Christianity, which I think of myself and my church as part of, but Judaism, you name it, care of the sick and the injured. And I think if you research this, and I have tried over the years to find statements from various religions about it, the care of the sick and the injured is a universal moral imperative. And so that's what I use. And in groups of people who I can assume here in Utah are oriented towards the LDS Church, I go to the extent of thoroughly covering the quoting of scripture from various parts of our sacred texts, not just the Bible, but others.
Thank you. And presumably you don't fold in other progressive issues.
No.
Okay.
No. When it comes to reproductive rights, and when a question about that is asked, what I say is, we will fund medically necessary care that is legal in Utah. And I don't try to fight that fight, even though I have a strong opinion about that. And it's very much, I guess I could say I'm both pro-choice and pro-life, but I'm just fine with abortion being legal. Because that is actually, when I was the bishop, I read it in the bishop's manual. There are circumstances where that is perfectly the right thing to choose to do. Therefore, it should be something that women with their help of their physicians and others can choose to do. But I never try to fight that fight. I just say whatever's medically necessary that's legal. That's what we'll cover.
Okay, thank you, Sam. Lee, I see your hand is up again. I don't know if you pulled it down from before. Okay, just pull it down if you would. Hank, you're back up, then Barbara, then Mike, then Bill, then Julie. Just to be mindful, we're 12 minutes from the top of the hour. Joe, can you go a few minutes past if necessary?
Sure.
Okay, all right. But everybody keep your, your questions. You've been doing well, everybody. Keep your comments, questions brief. Thank you. Hank?
Legal challenges. Have you thought about that at the state and the federal? Even though you're going to be careful with ERISA, we think we understand how to manage ERISA. And again, we're not taking over the federal program, right? We're just offering a wraparound, Part D coverage or a Part C plan. The thing I'm worried about is the takings argument. If I'm a business and I want to provide health insurance for my employees and I have to do that and pay an 8% tax, 10% tax, whatever your business tax is, that is in a sense, I would say, a government takings argument. You're forcing me in an impossible decision, and the government should never force an individual or a business into that sort of argument. Have you prepared at all for not only the progressive arguments? Again, I would say reproductive rights will be reproductive care will be determined by the health board. That will determine what is the basket of covered services. It has nothing to do with this initiative. But let's say court challenges. What have you thought or planned in that regard?
That is the reason why it's so important that the Utah Cares PIC leave behind a very active and currently moving forward group, which is Common Sense Healthcare for Utah, a 501c4. Their job is to get ready for exactly that fight, which we anticipate will happen. Their job is to build. This is exactly what happened with the Boundaries Initiative. They had a 501c4 that continued to build its strength, did not run the campaign, was not involved with the expense related to that. But whatever money was left over for the campaign was added to what they could collect as a nonprofit, and they have fought the legal fight. They're the ones that have gone successfully to the Utah Supreme Court. That's what I anticipate will happen. I'm now running a campaign with my campaign manager, and we recognize there are all kinds of perils, and there's 1,000 reasons why we might not succeed at this. But if we do succeed, then it's back in the hands of Common Sense Healthcare for Utah to defend it and keep it going on into the future.
Thank you, Hank. Barbara?
Yes, well, thank you again. I have been watching your work for quite a while. Not 30 years, however. But I'm also one of the people that works on the map for one-payer states. And I spent some time last year on Common Sense and Utah health security and so forth, and put some things up under Utah to show that there was infrastructure and things happening. But I could use some help to bring it up to date. Can I call on you?
You sure, absolutely. Give me a call. I'd be happy to help you with that.
And you'll
Great.
let
Thank you,
me know.
Barbara.
Okay.
Appreciate that. Mike, then Bill, then Julie, then Ann. Mike?
Yeah, I can't highlight myself, but I have a concern about gross receipts tax after the experience we've had in Oregon, where corporations that have lots of receipts but a thin profit margin get hurt more than companies with the opposite. In particular, the Corvallis Clinic found that. Any solutions to that concern?
Actually, that's a great on point current debate here within my group about what we're going to do with that. I have hired a group called Econo West, which is some people who have worked for the Utah Tax Commission or the Legislative Counsel Bureau in the past, and so they have an intimate understanding of the tax code and how it plays out. And I basically, that consultant, I said, we need to make sure that nobody can make the argument that we're killing startup businesses or marginally functional businesses with this tax. So I want to find a way to exempt them. That may mean that we have to alter our rate And by the way, our rate is calculated at present somewhere around 3% for gross receipts to cover what we need to cover. And that's a generous amount, so that I think we'll actually be able to drop it down in the future instead of have to ask more. But we don't want, if we have to increase that rate, we will increase that rate in order to not be the cause of the demise of small business.
Okay, thank you,
Thank-
Mike. Thanks, Mike. Bill, then Julie, then Ann. Bill?
Thanks, and thank you, Joe. I'm thinking that Utah probably has a similar situation as here in Colorado, where I am, that the rural hospitals are really hanging on by a thread, if that. And have you gotten any support from rural communities of how a single system could be a lifeline for their hospitals, and that could be a way of generating some of the support among relatively conservative communities that might not want to join otherwise?
So another aspect of the unique landscape in Utah, some years ago, and that's decades now, the legislature passed sort of a surcharge on urban hospitals that goes directly to support rural hospitals. So we haven't had a rural hospital failure in Utah. So many of
Wow.
the rural communities aren't. I mean, they're struggling trying to staff those hospitals. They have a difficulty. There are a variety of problems that are really true. We have 5 major national parks in the very rural frontier areas of the state, and they're flooded in the summertime with visitors, tourists, and they overwhelm what's available out there in rural health. So there's a bunch of rural health issues, but that's not one of them. And so yes, I have gone out to many, but not all yet, of the rural communities and spoken in public and tried to engender, but it's not been an automatic. Rural Utah is MAGA territory. So there's a great deal of suspicion about a quote unquote government solution. So I've got a lot of uphill climbing to do, and I have to make that because the ballot initiative signature process requires that I get a number of signatures equivalent to 10% of the voters who voted in the recent governor's election, meaning the one that's coming up now. We'll find out what that number is, but it's not just overall in the state. I could collect 10% in Salt Lake County alone if it were just anywhere in the state. I must collect those in 27 out of the 29 Senate districts. So we have to succeed in the rural community. So I mean, that's one of the many hurdles that's in front of us.
Good question, Bill. Thanks for the answer, Joe. Julie?
Yeah, just very quickly, I'm curious if you've had any conversations in the past or if you're looking to any future conversations with Mitt Romney.
I tried assiduously for months and months during this time frame when I was chairing Common Sense Healthcare for Utah to get on his calendar and meet him in person, and I never succeeded. There are some very high roller sort of donors who are close friends with him who are allies and who made personal calls to try to get me on the calendar, and he never made time for me. And that I did spend a lot of time with his staff member who was over domestic issues, including healthcare. And she listened for a while, but I think mostly she was listening to find a reason to say, we're not interested, and reassure the senator that there was nothing there for him to be worried about. So I never broke through.
Yeah. Thanks, Julie. Joe, Ann?
Hello, Dr. Jarvis. Thanks for coming to Minnesota last year. I still remember your remarks at our event around Medicare. So, and there might be people on this call who know more about what happened in Colorado than I do, but my memory is that Colorado did a ballot initiative for healthcare
It was in
payment reform
2016. Yeah.
a few years ago, and it's it seems like I heard that as soon as people got serious and got this question on the ballot, the private insurance industry came in and spent a ton of money making people worried, confused, and then the confused mind says no, is a marketing principle I learned a few years ago. What are your thoughts on that as a?
Yeah, it's my understanding, having talked with Rick Shannon and others in Colorado, they raised $800,000 for the campaign, and they were outspent 10 to 1. And
Yeah.
you're right, they created enough confusion so that
Mhm.
even people who were naturally or should have naturally been their allies didn't vote for it. They lost in such a big fashion. They were stunned by it.
Mhm.
So I anticipate this is what I mean by changing it from an educational to a campaign strategy. When you're trying to run an educational campaign, you're trying to help people understand this in various dimensions and get to some level of detail, get into the weeds, so to speak. So I give a grand rounds where I'm talking to a group of doctors and we're going through the PNHP slide set and we're actually trying to understand lots of things. That's not a campaign. What we have to do is what they try to do, which is cast aspersions on it and make people doubt it. We have to make people doubt them. I think the electorate in Utah, as our polling indicates, is ready to believe that there's a better way to do this.
Yeah.
And we don't need to tell them that it's PEHP and that all the other details. That they won't care. What we do need to say to them is, you like your doctor? This is what Obama did when he sold Obamacare, right? If you like your doctor, you can keep your doctor. We've got to come up with those phrases that work. So what we need is a fairly large amount of money. We've got to spend money to just collect the signatures. That's probably a couple $1 million, but we'll need millions after that to actually figure out what the message is and then hammer that message home and be ready, agile to answer whatever they come up with in opposition. That's the millions. That's where this is going. You're absolutely right. That's why we're running a political campaign, not an educational campaign anymore.
Right. And to that point, you want to inoculate yourself, right? You want to get out in front of messaging because you know what's coming at you.
Yeah, this is actually why it's so hard to do single payer reform.
Mhm.
It's much harder than getting women's votes. It's much harder than civil rights. It's much harder than gay marriage because it's got this gigantic 20% of the gross domestic product commercial interest opposing it. It's that hard. We that is why this is difficult, and I've hired a campaign manager, and what her statement was, she's run Democrat campaigns in Utah several times over, and she said, "I'd love to do this for you because what you're selling is more popular than any Democrat in Utah." I'm a happy camper now. We've just got to capitalize on that popularity.
Right, right. And the unpopularity of corporate America, especially the medical industry, right? The greed, the avarice, the hubris, all that. Right?
Every family has a bad health insurance story, and we just need to make sure that we touch that.
Beautiful. Clarifying question. You referred to Utah as open shop. That's not the same as right to work, correct?
Yeah, what that means is no one can be compelled to join a union. So if you try to unionize a shop, you can't have a vote and then everybody after that, the vote goes yes, we're unionizing, and everybody has to join the union. That doesn't happen in Utah.
Okay, all right. Yeah, that's pretty, that's another version of right to work. But and the public employees, especially at the universities, the public universities, you've worked to cultivate relations over there, I imagine, right, as well?
Oh yeah.
Faculty unions and so forth.
Yeah. Well, I offer to everybody I run into as I go along, including the private university. The major private university is Brigham Young University.
Right.
Every time I get a chance, I offer to come and speak, and I take whatever invitations come, so that and then when I meet the faculty, I say, how can I speak to faculty instead of the student body, only the student body. Yeah. So you work at it. Not easy. That's not easy work.
No, 100%, 100%. Having organized higher ed for more than 30 years, and got fired in from my last job, so I know what. But having said that, you're a great inspiration for all of us, Joe. I mean, you're in the firing line, and for all of us who may grumble about how difficult our work is in let's say less red places. I think you're somebody that we should keep in mind and keep in perspective, the kind of work that we're doing. And thank you so much for shining a light and giving us some good insight, really good insight on what's happening in Utah. And hey, if you can make it there, you can make it anywhere.
That's our hope.
Okay. All right. Mike, do you have anything you need to wrap up with? Any announcements?
Just if you want to keep these excellent presentations coming, click the donate button either on our One Pair Estates site, or if we can quickly get into the chat, and also support what Chuck's doing in Washington, D.C. Excellent stuff none of us can do without somebody being there knocking on doors. So please donate.
Yeah, 100%, you know, and I'm trekking every weekend up to Pennsylvania, just knocking doors. That's a major swing state, as you know. So the work continues, radical hope, but we also have a strategy. I mean, a very clear strategy. And for those folks who are interested in that strategy conversation, always open to it. Joe, I think you've seen my 16-point document that I put together. Let's just keep chewing on that, and happy to help in any way possible, for you as well as other folks around the country. With that said, we're now within 19 days of election day, pivotal election. Just keep slamming away, support folks, especially who are doing the work in the swing states, such as myself and others. And we're going to win this thing. We need to cross this bridge over these shark-infested waters. And then our movement really needs to go into action. And we're going to be working during the congressional lame duck session after the election. We're going to continue building for the passage of SABUCA as early in 2025, get it introduced as early as possible. And just to let you know on background that, you know, continuing the conversation with Pramila Jayapal, her staff, her new staff, they've just hired some new folks in regular conversation, and want to make sure that she carries this message that we talked about in Chicago at the Democratic Convention, which is we need to coordinate our work at the state level with the national level. We need to support each other and make sure that we lift each other, and that our messaging is strong and consistent, appropriate to each environment. Joe has a very unique cultural environment he's dealing with, as do others. But as much as possible. And I certainly want to make sure that she carries that message into the PNHP conference, because she's going to be the keynote speaker, right? Pramila Jayapal. So I'll nudge her in that direction and reinforce that from this end. But anybody who has contact with Pramila and her staff, and anybody sees her at PNHP, laud her, praise her for her strategic thinking, and the critical importance of connecting the state work with the national work. We're all pulling in the same direction. We all aspire to national expanded and improved Medicare for all. How do we get there? You know, it's our theory change. It's likely going to happen through the states, but we are all in for the fight at the national level and also regional collaboration. So this is really, really a pivotal turning point, I think, in our politics. So everybody keep going. Yeah.
Chuck, there are two hands up that have been up for a while.
Okay, I did not see them previously. I just wanted to put a wrap on the meeting today. Naibingi and Barbara, real quick. Naibingi, who's from LA, has recently joined us at One Pair Estates. Naibingi?
Yes, I wanted to know, I know, Chuck, you've been tracking the House races, and there's a couple of seats here in Southern California that Republicans are holding that look very vulnerable. And do we just need to flip 5 seats in the House for it to be Democratic? And also, what is your prospect on us flipping the House? I guess that's the general question. Yeah.
I think it's above, the chances are above 50%, but you know, my radical hope is that we're going to have a unified government coming out of this election. I mean, we're watching Donald Trump melt down in real time. And Harris had an amazing, I think, performance with Bret Baier on Fox the other night. I think the tide's turning, personally, and I don't even invoke the D or the R words. You know, we want those folks who are going to work with us, and we have to figure out, you know, how to transform a potential Harris administration into a pro-universal healthcare, pro-single-payer Medicare for all administration. And you and I are going to be working on getting Barbara Lee, who really is a mentor to Harris. They're both from Berkeley, California, and also LaFonza Butler, who's the senator who is very close with Harris. So the way to get to these power brokers is to get to the people who are closest to them. So we'll continue doing that work, and other people, if you have creative ways of getting, again, to Pramila, to Bernie, to other leaders on healthcare, Markey and so forth, that's the way we're going to get this work done. So Nine Bingy, thank you for your work. Appreciate you. We'll keep the conversation going. Barbara?
Just very quickly, I want to say that for any, I've been using the phone banks for the Center for Common Ground, and she goes into all these states. It is the easiest and most satisfying phone banking that I have done in years. And if you have, if you haven't been able to connect, or if you have friends who say, oh, I just don't know how to do this, send them to the Center for Common Grounds. There's a thing, phone banks, and it's so satisfying. Mostly you're leaving messages, but when you connect, it's been so good, and it's a very short message. Anyway, Center for Common Ground. It's do it.
Drop the link in the
It's free
drop the
meetings.
link in the chat then, Barbara. Yeah, for folks. I dropped the donate link into the chat. And also did a strategy presentation the other night with PNHP Washington. Just to get a clearer sense as to what that strategy looked like. It begins with the radical visioning, and Joe does that every day. He has to see the success before you can actually believe in it. You have to see the success and then reverse engineer and ask yourself, what were the steps that were required to get us to that success? And that's the kind of work that we're doing, which is really pretty unique in social justice organizing spaces. So thank you, Barbara. Thank you, Joe. Thanks to everybody for being here, and everyone have a great weekend. Keep fighting, and support the work that we're doing as we support the work that you all are doing out across the country. Thank you so much.